Good afternoon, everyone. My name is Anna Hyde, and I am the Vice President of Advocacy and Access for the Arthritis Foundation. I want to welcome you to this very timely webinar on this very important topic of healthcare reform. As many of you know, the Arthritis Foundation and the American College of Rheumatology work very closely together, and both of our organizations have approached Congress this year with the same set of patient principles, which you will hear more about in a minute. We thought it would be a good idea to join forces on this webinar so you can hear both the patient and provider perspective on the potential impact the American Healthcare Act and the Better Care Reconciliation Act could have on the arthritis community. Our speakers today will be Dr. Andy Crichton, who is an AF board member and chair of the Advocacy Committee, and Dr. Angus Worthing, a practicing rheumatologist and chair of ACR's Government Affairs Committee. Andy Crichton will talk about our patient principles to frame the discussion. Angus Worthing will talk about what's in the bill and how it can impact you, and I will come back in at the end to talk about how you can get involved. So now for some quick housekeeping. First, if you have questions as we go, please use the chat feature to send your questions to the host, and we will answer them at the end. And second, although we know this legislation has gotten very political, we want to just send a reminder that both of our organizations work on both sides of the aisle, and we know that we have members and volunteers on both sides. So we are focused solely on the policy side of the debate, and any concerns we have about the legislation stem from whether the policies fit our patient principles, and we always use those principles as our guide. With that, let's dig in. I'm going to set the stage for the conversation, and then I'll turn it over to our speakers. So as you know, a major priority of the Republican majority in the House and Senate has been to repeal and replace the Affordable Care Act, which was passed into law in 2010 under the Obama administration. While neither the House nor the Senate has proposed a full repeal and replace, both chambers have put forward legislation to repeal and replace parts of the ACA. The House passed the American Healthcare Act in May, and the Senate just introduced its version last week. You probably saw in the news that just yesterday, the Senate Majority Leader, Mitch McConnell, announced that the Senate will be delaying a vote until after the July 4th recess. And to give you a quick idea of how AF and ACR have engaged so far, both of our organizations have expressed concerns with certain provisions of both bills, which you'll hear more about later. The ACR president and AF CEO recently authored an op-ed laying out our patient principles. Both of our organizations have called on our members and volunteers to get engaged. Both of our organizations have written letters and statements, and both of our organizations continue to engage on the Hill as recently as yesterday when we met with several key Senate offices. We want to emphasize that despite any concerns we may have, our goal is to offer constructive policy recommendations Congress can use to make healthcare truly work for patients, and that will continue to be our approach moving forward. So now that the groundwork has been laid, I'm going to introduce Andy Crichton to talk about our patient principles. Andy?
Thanks, Anna. So as Anna said, I'm Andy Crichton. I'm an Arthritis Foundation board member and chair of the Advocacy Committee. But before we discuss the impact of the latest House and Senate health reform bills on the arthritis community, I wanted to take a few moments to walk through 6 patient principles that the Arthritis Foundation and the American College of Rheumatology are using to guide our responses to legislation. Principles were developed after extensive interviews and surveys of patients and providers like you. Each principle reflects an important protection gained under the Affordable Care Act that could be targeted with the latest health reform legislation. Later in the presentation, you'll learn more about whether the House and Senate bills meet these requirements. The first principle is that any bill should protect caps on annual out-of-pocket patient costs. Today, patients are protected against catastrophic costs, that is, after you spend a certain amount on deductibles, co-insurance, or co-payments. Your health plan pays 100% of the cost of those benefits for the rest of the year. The second principle is there should be health insurance available to all Americans that provide continuous coverage without exclusions for people with pre-existing conditions. Today, insurance companies cannot discriminate against people who have pre-existing conditions. Continuous coverage is currently required by the Affordable Care Act through the individual mandate, which fines any person who does not carry insurance. The third principle is that there should be a ban on lifetime limits on health care costs. Under the Affordable Care Act, health insurance companies cannot limit yearly or lifetime coverage expenses for essential health benefits such as prescription drugs, And in other words, insurance companies cannot set a dollar limit on what they spend on essential health benefits for your care during the entire time you're enrolled in that plan. Fourth, there should be affordable premiums, deductibles, and cost sharing that takes into account the complexities of people with arthritis. As you know, biologic therapies are often placed on an insurance company's specialty tier, meaning patients must face higher out-of-pocket costs to pay for these treatments, often reaching coinsurance amounts of 40% or more. Any reforms to the healthcare system should ensure that these types of out-of-pocket costs are more affordable. Fifth, any proposal should ensure a continuation of the currently required essential health benefits so patients have access to a robust set of healthcare services. The Affordable Care Act mandated a set of 10 categories of services health insurance plans must cover. These include doctor services, inpatient and outpatient hospital care, prescription drug coverage, pregnancy and childbirth, mental health services, and more. Elimination of some or all of these essential health benefits could mean increased costs for patients to receive treatment. The last principle supports the idea that there should be continuation of the policy to allow children to remain on their parents' health insurance until age 26. This is a popular part of the Affordable Care Act, and both the House and Senate bills do ensure this policy would continue. So with these 6 principles in mind, let me turn the presentation over to Dr. Angus Worthing, a practicing rheumatologist and chairman of the American College of Rheumatology's Government Affairs Committee, to discuss the specific impacts that the House and Senate bills may have on the arthritis community. Dr. Worthing?
Thank you, Dr. Crichton. I want to thank the Arthritis Foundation for hosting this very timely webinar and helping us get all this important information across to people. As Dr. Crichton and Anna Hyde said, I'm a practicing rheumatologist. I'm talking to you today from my desk in Washington, D.C., and I lead the Committee on Government Policy for rheumatologists at the ACR. I'm going to talk about 4 quick topics: the specific state effects of the Senate bill, some larger changes countrywide that it proposes, the specifics about Medicaid, and then fourth and lastly, some elements of the landscape of how this might go forward in the next weeks or months. So on the slide you're seeing now, depending on your state, each state, according to the Senate bill, would have the ability to apply for waivers so that they wouldn't have to follow the specific essential health benefits that are currently protected by the Affordable Care Act. So the level of benefits might change if a state were to apply for and gain a waiver. Some of the consequences of a waiver might be removing the caps on annual out-of-pocket spending, or changing the ban on lifetime limits for costs, so that might be rolled back, increasing the deductibles or premiums or coinsurance, or simply declining benefits covered under a plan. And the reason this is important is that for my patients that I see in the office, prescription drugs to treat like anti-inflammatories, disease-modifying drugs for autoimmune diseases, rehabilitation services like physical therapy that get people back on their feet, sometimes hospitalizations when it's needed. All these things are covered under the essential health benefits, and they could potentially go away or be reduced. Some of our more expensive drugs, I would imagine, might have the first to be targeted. Go on to the next slide. We'll talk a little bit about the countrywide effects of the Senate bill. If this version passes, the Congressional Budget Office, which is a nonpartisan research arm of Congress, proposes that more than 22 million Americans would not be covered by health insurance 10 years from now, compared to if the current system were in place. Specifically, it would allow insurers to charge people based on their age 5 times more than younger Americans, whereas currently they can charge 3 times more for premiums. So until people get to Medicare age 65, there'd be more of an age discrimination, especially impacting people in their 50s. Secondly, it would change the tax credit structure for lower income Americans and reduce the overall amount of tax credits. Essentially, what's going on right now is people can either have a tax credit or, in order to buy insurance through the Affordable Care Act, have a cost-sharing subsidy, and this would remove the subsidy but instead have a refundable tax credit. It would expand the use of health savings accounts and flexible spending accounts. It would remove the individual mandate so that if people were not covered by insurance, they would not pay any penalty, and they would replace that with a continuous coverage provision. This might create a situation where people pay extra for their health insurance if they haven't been covered. And then finally, it eliminates the Prevention and Public Health Fund, which can impact public health funding for critical arthritis research programs. We've found out that if we don't count the number of people with arthritis and rheumatologic diseases in this country, those people can get ignored by prevention and health programs and by Congress. Moving on to the next slide. The specific changes to Medicaid that the Senate bill provides over the next few years, and specifically at 2021, the enhanced federal funding for Medicaid expansion would start phasing out, which would force states to reduce the total number of enrollees. States would then have the option to change their Medicaid funding into a block grant or accept what's called a per capita cap. Very briefly, a per capita cap would be that instead of the way Medicaid is funded now as what's called an entitlement, where a state would, a certain portion of a state's Medicaid expenditures are funded directly by the federal government. Under a per capita cap, each type of demographic person in the Medicaid system in that state, such as pregnant women, children, people with addiction, people with certain diseases, there'd be an average cost associated with that person calculated, multiplied by the number of people with that condition or in that demographic, and then that state would receive that sum total of money added up all together. And if expenditures at the end of the time period were more than what the state was provided by the government, the state would have to make up the difference or cut benefits. So this might result in more restrictions on coverage, limited access, especially to new arthritis medicines, and so we're pretty concerned about that. Move on to the next slide. So what happens next? Some of you may know that yesterday the Senate Majority Leader decided not to have a vote on this bill this week. The Senate will go out for a recess and go home next week for July 4th, and then come back and work in Washington until another recess in August. So at this point, the bill is somewhat paused, and the Senate will be able to consider amendments to the bill and change it to what might make it more palatable to either moderates on one side of the Republican Party or conservatives on the other side of the Republican Party. There are 52 senators in the Republican caucus, and 50 votes would be required to pass the Senate, with Vice President Pence being able to break the tie and vote. If it passes, this bill would either, before going to the White House for signature, would either have to go to the House to be passed so that they would pass an identical bill, or it would be merged with the House bill in the conference committee. And if the Senate and House pass the same version, once that happens, the bill goes to the President's desk, and we anticipate that it would be signed into law. On the next slide, I think we're moving over now to Anna. I want to tell her what, or she can tell you what you can do.
Sure, thank you so much. So a lot of you have been asking for ways to get involved, and so we wanted to bookend the presentation with some examples of things that you can do. First and foremost, though, want to make sure that you know about some of the resources that are on both of our websites. You can visit the ACR Legislative Action Center on their website to send messages to your senators and representatives, and there are the web links right there. And then on the AF website, you can find some FAQs that we did for both the House and the Senate bills that go into greater detail about what each bill would do and how that could affect the arthritis patient. Our patient principles are also there so that you could refer back to those as well. And in terms of specific things that you can do, you can always call your senators and representatives to let them know what matters to you in healthcare. They really do relay those messages on to their bosses and tally up those calls, so that is important. You can always share your stories on social media as well. We know that in the past couple of years in particular that members of Congress pay close attention and are paying closer attention to Twitter. Wanted to let you know that there is a hashtag that a lot of patient advocacy groups are using, hashtag Protect Our Care, and you are welcome to use that. And last but not least, since the Senate is delaying their vote until after the July 4th recess, you can attend a town hall or other event during the 4th of July recess. You are also welcome to reach out to both ACR and AF's government affairs team anytime. We're always happy to help you find an event or answer a question or just get in contact with your elected officials. And with that, I think we'll move on to questions. So Julie, would you like to read first question?
So just so everybody knows, in our chat feature, you can type in any of the questions that you have or have throughout the presentation. One question we have here is, what's the implication of eliminating the public health fund on people with arthritis? What does that look like?
Sure. So the Prevention and Public Health Fund was a mandatory pot of money that was included in the Affordable Care Act. And it's actually been used to fund a lot of the base programs that our public health agencies do. So that's research, and for arthritis in particular, the Centers for Disease Control and Prevention fund an arthritis program. It's the only public health program devoted solely to arthritis, and this fund actually goes towards about 12% of the overall CDC budget. So if you were to take away this prevention fund, you're taking away a big chunk of the money that CDC has to work with, which we know from working with members of Congress, the smaller programs like the arthritis program tend to be some of the most vulnerable. So we certainly have concerns about that.
Great, thanks. Another question we have coming in is, if you have private insurance, how will this health reform legislation impact you?
Well, there are a number of ways that the Affordable Care Act actually affects everyone, even those who have private insurance through their employer. And one of those ways is through the essential health benefits. So the essential health benefits are guaranteed to anyone, whether you're in an exchange plan or an employer plan. So if you are covered through your employer, and in a hypothetical scenario, the state in which you live decided that prescription drugs were no longer going to be considered an essential health benefit, then all of the protection guaranteed through those essential health benefits would no longer be protection. So that includes caps on annual spending and the ban on lifetime coverage limits. So that means that if you're paying, say, a 40% co-insurance on your biologic medication, that you would reach that, what is now in law, roughly $7,000 annual cap, and blow past that and not have any limit on how much spending your insurance plan could charge you in a given year.
Great. One more question on essential health benefits. One participant is wondering if any state can waive the essential health benefits or if it's limited to a certain few.
Any state could apply for the waiver. There are some requirements that they would have to meet around coverage and access. They basically would have to show that they have an alternative way of covering certain benefits and reducing premiums and certain things like that. But any state would be eligible to apply.
Great, and one more question we have coming in is, during the July 4th recess, some of our participants might be available to attend a town hall, but what types of things should they say at a town hall, or how should they share their story there?
I think the best way to do that is to really condense down, because likely, whether it's at a town hall or another event, you're not going to have a lot of time. So I would really focus on the one thing that is most important to you, or that's most compelling about your story, and really focus on that, and make sure that you have a very clear ask. So if it's vote no on the health care bill, that would be your ask. If you want them to modify the health care bill but support it, then you would say that very specifically. So plan to be able to have basically 2 sentences worth of time, one to sort of frame your story, and then one to deliver an ask.
Great, we have another question about, if an insurer has a waiver that's approved, will patients still be able to appeal their denials of coverage?
Yes, I don't believe there's anything in either bill that affects that process. Insurance companies, there are processes that they have in place for allowing consumers and patients to deny or to appeal denied claims, which still exists. It may change the overall dynamic of that, though. It could affect, and it really depends on the state and how they structure their waiver. But it could definitely change the way formularies are put together and things like that. And in a situation where you might see more restricted formularies, then you would be in a situation where insurance companies are probably getting more appeals. So it could definitely change the dynamic, but I don't believe it would change the sort of underpinning of how denials work.
Great, and one final question to kind of wrap it all up. We have some participants that are wondering how long they have to act before the Senate will vote on the bill. How long they have to tweet their member of Congress or go to a town hall, those types of things.
Well, I think you have at least the next week and a half. The Senate will come back into session on Monday, July 10th, and it will take at least a few days to go through the procedural hurdles that they have to go through to actually get the bill on the floor for a vote. So I would think that even if they have everything in line to begin that process on that Monday, it will be a minimum of, I would think, Wednesday before they could actually vote on a bill. So you have approximately 2 weeks to tweet at your senators, to call their offices, to find town halls and other events and things like that. But I think the earlier they hear from you, the better.
Awesome. So with that, we're going to conclude the questions portion unless somebody else has any others.
All right, well, we want to thank you all so much for joining the webinar. As I mentioned earlier, you are always welcome to contact our government affairs offices with any questions. If you have any specific follow-up questions or want more specific ways to engage, please don't hesitate to contact us. Thank you so much.